You're listening to Grown and Growing with Sonia Hamlin. Hello, hello, hello. Welcome back to Grown and Growing. Thank you so much for joining me today. I'm so glad that you decided to tap on that play button because we have a really good episode today. I've just spent 2 hours trick-or-treating in the rain with my daughter. And so I feel like I deserve some bonus points for coming back and getting this podcast wrapped up, walking with her for 2 hours. I feel like a super mom right now. But because of that, I'm just going to get right into what this episode is about. Today, we are talking about the adolescent mental health crisis that we're currently experiencing in the United States. A few weeks ago, maybe about a month ago, on my favorite news podcast, The Daily, there was an episode about the mental health crisis in the United States among children and especially adolescents, so those preteens and teens. And they were saying it was at crisis levels and that primary care physicians who typically treat, this age of kids didn't exactly know how to treat this crisis because they are equipped to treat physical ailments, but not necessarily they don't necessarily have all the tools to treat mental illness. And so is creating this crisis in the United States. So I was very interested in that news story, and I wanted to learn more, not so much about, what's causing the crisis, though we do get into that in this interview that's coming up, but also how can we look for signs within our own children or in the children that are in our lives? How can we spot signs? How can we be better parents? How can we be more vigilant to support kids in surviving in a world that's very different than how we grew up? My guest this week is Dr. Jari Santana-Wynn. I have known Dr. Jari for almost 20 years, over 20 years. And not only is she an amazing clinician, she's also an amazing human being. So I'm going to tell you a little bit about her background and why I wanted to have her on the podcast. Dr. Santana-Wynn is a child and family therapist, parent coach, international speaker, and certified LGBTQI plus trainer with over 20 years of clinical experience. She earned her Ph.D. in clinical psychology from Miami University in Ohio and has worked in community mental health clinics, hospitals, and schools. Her clinical experience is focused on child and adolescent mental health, trauma-informed care, immigrant mental health, and acculturation stress. Dr. Jari's own experiences as an Afro-Latina immigrant child drives her commitment to culturally competent mental health services for minority communities and makes her a tenacious advocate for their social, economic, healthcare, and educational needs. Before we get into the episode, I do want to mention Dr. Jari's video project she has called Decolonizing Parenting. Decolonizing Parenting is a video course where Dr. Jari and her sister discuss non-coercive and non-violent parenting strategies that are consistent with Afro-Indigenous child-rearing practices of our ancestors. It sounds really cool. So basically, how were our ancestors parenting children before slavery came into play? We talk a little bit about it at the end of the episode. Anyway, there is a promotional code for listeners who want to download this video series. 50% off if you use the code Grown and Growing. That information is in the show notes. Now, without further ado, let's get into this topic. Welcome to the podcast, Jari. I'm so glad to have you.
Thank you, Sonia, for inviting me.
Should I call you Dr. Jari? Can I call you that? What do the kids call you?
The kids call me Dr. Jari.
Okay. Thank you so much for coming to the podcast. I am so glad to have you here. I was thinking about this podcast all day because it's such an important topic. And I wanted to make sure in the time that we have allotted that we cover all of my many questions. One of the things the thing that sparked this conversation or that prompted me to want to have this conversation with an expert is because I was listening to a podcast called The Daily. And that day, the podcast was about how mental health issues like depression, anxiety, and other mental health issues are at crisis levels among adolescents and children. And that was so shocking. I mean, it wasn't shocking to me. It was surprising, but also I know people with teenagers and adolescents who are having issues with mental health. And so I really wanted to talk about this with somebody who specializes in that. And luckily, I have great connections because you not only do this for a living, but you have your PhD in it. You have studied this. You have 20 years of experience working in pediatric psychology, right?
Yes. Yes.
Pediatric psychology with a specialization in several things, but one of them being trauma. And
Correct.
so before we get into the meat of it, I do want to, I talked a little bit about what you do, but tell us what you do specifically and what draws you to that work.
I play for a living. That's the best answer. Nice. That's what my children believe at the very least, because I have a playroom, right? So my children believe that I play for a living, and that's the best answer. But really what I do is I work with children and families in helping them navigate difficult situations and behaviors that many times children present that are disruptive to their daily life and function, and certainly to process their emotional responses to certain situations that they have lived through. Or also sometimes I help parents with children with developmental disabilities, such as autism, which is one of the things that I trained in as well when was doing my internship at Lincoln Hospital in the Bronx many, many years ago. Mm-hmm. And what draws me to the work? That is a great question, Sonia, and I'm glad that you asked. What draws me to this work is the passion that I have for healthy and happy families. I grew up in a really loving home, but it was not devoid of stressors. And yeah, you met my mom, so, and my dad and my siblings. So yes, a very happy home, a very loving home, but not devoid of stressors. And so I know that even the best parents can struggle at times to support their children to difficult situations. And if I can be a person who can help make and bring kind of balance to a family's life, and by simply providing new tools, then that is the least that I can do. I am an immigrant child, and one of the things that I noticed growing up was that there was nobody helping us navigate that. And so one of my passions is actually working with immigrant families. And through that work, initially was mostly Latino families, Latino immigrant families, but I've worked with a lot of different ethnic minorities over the years. And so that is the work that I love.
Awesome. And you are well suited for it, just based on what I know about you. So what ages do you typically work with? So you mentioned children. Are you, so very young children to teenagers? What is the range?
My specialty when I started was 0 to 5. And that was the group nobody wanted, which is why I say I play for a living. Because really most of the work that we do is through play. And the thing that many parents don't understand is that children do work out their emotions, their traumas, their feelings, their challenges through play. And that's what we do. And of course, I started with 0 to 5 and doing early diagnosis for children who had developmental disabilities, but also these children grow, number one, but I also train in a child abuse clinic. And so I was seeing children up to the age of 12 in that clinic. The youngest I saw there probably had to be 3 or 4, up to the age of 12. And again, they grow. So I ended up working with adolescents by virtue of the fact that the kids I was working with were growing and they were still working through some things, or actually many children who were able to overcome a lot of what they had brought them in initially. And later on, when they presented or experienced a new challenge, sometimes something that may have seemed routine to most, they were like, I want to go talk to Dr. Jari because she helped me last time. And so I have my kids who return and every few years for like what I call a tune-up. And I
Mm-hmm.
love that. This is one of the reasons I love community mental health, being there where the families are and being able to support them when they need you in the way that
You know,
they need you.
the thought that I had, I'm like, gosh, everybody should have a Dr. Jari that they can bring in when there are difficult situations. It's interesting that you work with kids from 0 to 5, because it's like you think at that age, you wonder, rather, at least I wonder, what are they processing? How do they vocalize that? What are they internalizing at that
Sure.
age? Because it's so young. And I feel like that would be difficult to kind of ascertain where they are mentally and emotionally at that age. But
Absolutely. So the youngest, the under two, typically, actually, I want to say under 18 months, it was typically children with who were born with developmental delays, and we
mm,
were just assessing consistently just to make sure that they were keeping on track with the development and making appropriate referrals for speech development, PT, and things like
mhm.
that that they may have needed. A lot of children with sensory integration needs, and again, that we work through that through play, exposing them to different textures and activities so that they can become accustomed to them and learn to cope with the stressors that presents for them through routine exposure. But also, children with speech delays begin to present with behavioral disabilities early on, or behavioral
Mhm.
acting out. So many more outbursts, much more severe tantrums that last longer than what the typical tantrums do for 2 and 3 year olds. And so
Mhm.
that's most of what I did at that time. And then that's also the age when it's ideal to identify children who are on the spectrum, because early intervention allows us to have better outcomes long term.
Okay. So I want to start very broad and then focus in specifically on adolescents. So I know that mental health, if you have been paying attention, maybe it's on your timelines on social media, maybe it's in the newspaper, but I feel like um the world is at least it is more in the vernacular of people where we're talking about mental health more. And so the part about the podcast that didn't surprise me is that there is an increase in mental health concerns for adolescents, because that is probably the case for everybody. And I think an increased attention was put on this after COVID, right? There was isolation, there was a lot of death, there was a lot of unknowns about this disease. So there was a lot of anxiety about that. Then you add on the financial, um, you know, social aspects of it. If it affected your job, or if it affected your, you know, your life, outside of work. And so I think people like to associate it with COVID, and have that as a barometer, like before COVID, after COVID. But I feel like the article said that it's been going up for a while. And so one of the things that they talked about in this podcast is that more adolescents are presenting with mental health challenges. And also the pediatricians, primary care physicians, or ped, uh, pediatricians for kids, pediatricians, which are for kids, which we know, but they are not equipped to deal with all the mental health challenges. They're used to more physical ailments. And so this is presenting a challenge because they're seeing more kids and adolescents who have mental health problems, and they don't know what to do about it. So I want to ask you, what are you seeing in your practice, and what is the cause of this increase specifically in adolescence?
Sure. What are we seeing? In the last 2 years, I will say that we have definitely seen the impact of COVID. And part of that is some of what you shared. Another part that a lot of people don't understand, or haven't been able to quite put a finger on, because it's something that by its name you will see that it's difficult to pinpoint. It's called what we call ambiguous loss. There was a lot of things that we lost: routines and contact with people, self-care activities that were accessible to us, like going to the gym, or for children, the sports and after school activities. and even just going outside, going shopping, hanging out with friends, that ambiguous loss of things that were not concrete, right? It wasn't necessarily the loss of a of a loved one, or that, failing out of school or anything like that. But some kids did lose their supports, their academic supports that they had at school. It wasn't as easily accessible. And as I just mentioned, a lot of the children that I work with receive additional services such as PT and OT, and they were not able to have access to those services for a period of time. But that ambiguous loss also created a sense of timelessness. And so children struggle with feeling like nothing is happening and everything is happening. That's
Mm.
a big part, because they are growing. And whereas for us, 2 years, because of the many years that we have, and we won't name those, but 2 years doesn't seem as very significant. For a young person, it's a significant percentage of their life. And the other piece is that their entire life, although they already had a significant amount of their time that was spent online socially, but their entire life went virtual. And when they're looking at themselves on a screen, that creates an increased sense of self-awareness and self-consciousness that we weren't seeing before. So we have children who don't feel comfortable being, with their faces being seen, who don't feel comfortable with themselves. They look at themselves on the screen and they don't look the same as what they look on a mirror, because these apps and these cams alter us in some ways, right? And so we're seeing some of that, but mostly we're seeing increased anxiety about returning to school. And so a lot of school refusal is one of the things that we see, and anxiety about separating from home. Whoever, sometimes it's people at home, but sometimes it's just leaving their home space. And it's not necessarily fear of the outside, it's just anxiety about separating from home.
Mm-hmm. And so what about before COVID? So I think a lot of people like to blame, if adolescents are dealing with challenges around anxiety or depression, that's driven by social media, has a big play in that. Or maybe they blame it on video games, or maybe they blame it on the news and what we're experiencing in the world. How much does that play into what we're seeing in this increase?
So we had seen prior to COVID an increase in suicidality, at least suicidal ideation for sure, and anxiety in early young adolescent and high school age children. And all of that was unrelated. Again, it was pre-COVID. However, we do know that yes, the social media, that comparison, that increases depression, and again, that sense of self-consciousness of how I am perceived by others. However, one of the things that we also know is that children, particularly girls, are reaching puberty at an earlier age than they were before. And that means that there is a significant change and increase in hormones and changes to the brain that are triggered by these hormonal changes, including, the development of the frontal lobe, which is increasing in its development, and hopefully, we will reach full maturity of the frontal lobe, which is the impulse control center, by age 25. But a significant portion of it is happening in early adolescence. And so all of these things are happening, but the main function and process that is happening in the brain is all of this information these children have to figure out how they fit in the world. And that requires processing all this information. Their brain is literally working on launching them, where, you're becoming adults. Let's make sure that you know how to function in this world. And they are receiving so much more information than you and I were at their age. And they're starting earlier. Their brain triggers this mechanism, but they're younger. They're not fully ready to do all of that. And there is so much more information that they have to process. It becomes incredibly stressful for them, and they don't have the tools to manage that stress.
The
So we
tools or the
see these
maturity.
consequences. And maturity is one of them. The other ones are just the emotional self-regulation skills and impulse control And so they make poor choices, which come with negative consequences, both socially and from parents. And so there's a lot. They come in and they complain about a lot. They're really stressed. They don't want to be bad kids. They
Yeah.
just wish that it was easier to be good kids.
Hmm. So you mentioned something that I definitely want to talk about is the generational differences between people who are our age and the younger generations that are coming up now. So one of the things that these people shall remain nameless, but these are people that I know very well, will look at their 20-year-olds or their teens or their adolescent or what a preteen and say, they're soft. They're not as strong as we were. We were strong. These people are sensitive. They need emotional animals, support animals. They need to discuss. They need, a therapist. How do you they are different. How is it different? How are these kids different than what adults are experiencing? I'm sure there's a difference because of all the things that you've learned, but why is that considered soft, I guess? Probably because we're traumatized.
Oh, well, you just gave the answer.
Did I? So we really are traumatized. Okay. Okay.
So, that I mean, it's a funny response, but like before we move on, I want to say that earlier I made my little air quotes, but they were down here when I said bad kids. There are no such thing as bad kids or good kids. They're just kids, right?
Hmm.
But moving on, yes. So I hear a lot of that too. These kids are soft, and parents who tell me all the time, back in my day, right? And I tell them, back in my day too. And if it worked, you would not be here. You wouldn't need me. You wouldn't be asking me. So I'm going to ask you to do something different than what you already know how to do. Not because you're wrong, but because the tool that you're using isn't giving you
Mm.
that result that you want. And so you're right. Back in your day, that worked. It worked for me as well. There are a lot of things that worked back in the day that don't work for us now. What we do know is that, and I can tell you this because I have also had to work with adults, not by choice. No, I'm joking. I love my adult clients because I am trauma informed. And so I work with a lot of trauma clients who are adults. But what I do know is that part of what our children are learning is emotional self-awareness. And the way and the reason why they come across as softer is because they are unwilling to bury their feelings for our comfort. And I will
Mm.
repeat that again. They are unwilling to bury their feelings for our comfort.
There are some
Okay?
adults who need to know that. Seriously.
100%. Because I am working with adults now who still struggle with setting limits for others because the other person might get upset. And then I have adults who believe that they have no problem setting limits for others. But the minute somebody challenges their limits in any way, even gently challenges their limits, they become so emotionally dysregulated that these people have lost jobs, have lost relationships because they don't know how to deal with somebody is upset. And
Mm.
a lot of what I do is teach children we can be upset together. And I can help you sit in this feeling and tolerate it.
Where
We're
did
not
they
going to
learn that? Where did they learn that from? To not bury their feelings. That's a good thing, I think. I think it's a good thing. As somebody who used to feel like they're like, oh, I have to be strong all the time. Now I'm like, whatever, you're gonna get these tears. But what is that? Is that just because um they're so exposed to so many different things? How did they collectively become like that?
decide this is the cartoons. No. I mean, yes, partly it's the cartoons. It's we have introduced into the culture to become more aware of our feelings. And I believe that is happening at schools. I believe it's happening in their social circles. I see young adolescents setting up support groups for themselves. They have group chats where basically if you're struggling, you just text into this group of friends that is your emotional support. So this chat is only for emotional support. It's not just like I'm texting my friend group. This is my emotional support chat.
And so how can parents deal with that instead of seeing their kids as soft? How should we be seeing them? How can parents who may have not learned to deal with their emotions and their feelings, how can they relate better to their kids who do?
Yes, that is the million-dollar question. What I tell parents is this: what you want long term in our role as parents is to help to foster the healthiest adult that we can possibly raise and produce, right? So what that means is that the same way that you weren't thinking, you were exhausted, yes, when your babies were brand new babies and waking up every 2 hours to feed. You were thinking, I wish I could get more rest, but this is what this baby needs right now. And so look at each one of the developmental stages the same way. I wish that they weren't so emotional. I wish that he didn't cry over every little thing. But this is his developmental stage, and this is what he needs right now. What do? Empathize. First, value the feeling, identify it, label it, and then give them coping strategies for it. Not minimize it. Don't like, no, it's fine. No, it didn't really hurt. Because think about what we're teaching. If you teach a 5-year-old, oh, that didn't really hurt, right? How is the same child later on going to trust his body to tell him that what he's experiencing is real, is the real illness, that you shouldn't put off going to go to a doctor, that, if a spouse assaults you, it wasn't that bad, right? And so it's about teaching them to listen to their bodies, and not for us to believe that we know more about their bodies. Can we teach them, when I hurt, this is what I do, this is what helps me. And so a lot of what we can do for our children is actually to pay attention to the way that we express our emotions, because ultimately children do what they see parents do. Not what we tell them. They do as we do. And they don't do it right away because, again, their brain is developing. Because you might say like, oh, but I clean and these kids never clean.
Right.
But they will. Get it. They'll get it because they're seeing it. Okay. And so if mommy is not losing her temper, if mommy isn't yelling when I upset her, then I will learn not to yell. I will pay attention to how does mommy do this. And mommy can say, you know what? When I'm getting very angry and frustrated, I take a deep breath and I go sit down and try to calm myself before I talk. And we can say that, we can promote that and show them that we do that by saying, I'm very frustrated right now and I need to take a little break. And when I'm calm, I'll come back and I'll talk to you. And so by modeling the way that we deal with our emotions, our children will learn. But again, recognizing that every child is their own person, the same way that you are your own person and you're not like your siblings, right?
Right. I am not. I'm the middle child, definitely not.
So it's developing that awareness and knowing that each child needs something slightly different. I commend parents who come into my office. I tell every parent who comes in there that coming into my office means that I know how much you love your child, because you're taking a huge risk in trusting me to help you co-parent the thing that is the most important to you. So you're allowing me to share in that experience. And I'm not an expert in anybody's child. I'm an expert in child development and child mental health, but each parent is an expert in their own child. So we can put together our expertise and come up with greater solutions that either one of us independently could.
Oh, this makes me feel so much better about life. Like I'm even more convinced that we need a Dr. Jari in our lives. Seriously. Okay, so I want to switch gears and talk specifically about trauma, because that is your expertise. You have expertise in that area. And it is something, I don't know if it's because of the way I curated my social media, and and mental health is important for me. But I hear a lot about trauma. So first of all, the use of that word, is so great. So how do you feel about that? Are we underplaying the use, or are we overplaying it? Are we getting it just right? Are we talking about trauma in the right way?
The thing with trauma is the thing that happens with almost everything that is every word that's psych related, which is that
Mhm.
it gets colloquially used in a different way than the way that clinicians use it. And so
Okay.
depression, when people say I'm depressed, that doesn't necessarily mean you would meet criteria for depression clinically. When
Mhm.
people say I'm anxious, that doesn't necessarily mean that you have an anxiety disorder. I'm panicking doesn't mean you're having a panic attack, right? And so
Right.
a lot of these words are also used colloquially, and that is it's important for people to understand that. Now, the pendulum swings. So at one point, nothing was trauma, and we ignored trauma, and then the other end now, everything is trauma,
Everything is
right?
trauma. Yes.
Yeah. And so we know that that's not true. The way that clinically we define trauma is an experience of an event or an ongoing condition that overwhelms the person's ability to process it emotionally or creates a sense of fear about their safety or the love or the safety or and well-being of a loved one, someone important to them. So
Mhm.
when you put somebody in that situation, that is what we consider a trauma. The impact of trauma has been studied extensively. That anybody who's interested in the ACEs study, adverse childhood experiences, we know that children who experience multiple of these events in their while growing up have negative life outcomes as it pertains to their mental health and their physical health, as well as in substance abuse, increased risk of suicidality, and so on. But the thing about trauma is that it sends the brain into fight or flight or freeze or fawn mode. As we know, it bathes the brain and the body in adrenaline. And if the condition persists or the situation persists, whether in real life or by having flashback memories of it, and that
Right.
continues to trigger, then the body creates what is called cortisol. And cortisol causes all kinds of damage to our bodies. And so we want to avoid that and we want to intervene as soon as possible. The cliche that children are resilient, it's not really a cliche. Part of it is they're learning, their brains are set for learning. And so we can teach them quicker than if we wait until adulthood. They are,
Mhm.
again, adults that I've worked with who have experienced trauma. And a lot of the work that I end up doing is trying to backtrack to early experiences of trauma that have solidified and are much more difficult to process as a result, and to switch the way that the person experiences it in their life and understands it and the role that it plays in their present than it is to change their perception and emotional response to a more recent trauma.
Mhm.
So with children, even though we know that they are resilient, resilience still requires that you receive something in order to build yourself and help overcome the situation that you struggled with.
Okay. So even when you were giving the definition of trauma, and even though it was limited, right? It was more specific. It still seemed broad. It seemed like there are still a lot of things that can fit. So, when people think about trauma, the easiest thing to think about are physical trauma, right?
Mhm.
Things that happen to you, um, you know, a rape or violence or something physically happening to you, or even emotional abuse where it's outwardly emotional abuse and attack on you without words. So there's that bucket. And then there is like trauma that maybe is normalized, like in the household. I don't is that trauma? So if you grew up in a family and your parents were married, but they never got along and they argued all the time, is that and you were affected by that, is that considered a traumatic experience?
It can.
Okay.
And I'll give you an example. I've treated children with who have not experienced domestic violence as we perceive it,
Hmm.
but who have grown up with parents who, like you said, argue. But these arguments get loud. And the child may be afraid that somebody's going to hit somebody. So again, safety of others and people you love.
Okay.
Right. I've also had children who have told me that they were afraid that one of the parents would leave. And in their young mind, the perception is the role that this parent plays in my life will be empty. And that need of mine will no longer be met. So if it's daddy and daddy's the one who works, we're not going to have any more money and we're not going to have food. If it's mommy, well, mommy's the one who takes care of me. I'm going to have to stay home by myself.
So that's interesting because it's all about how they process what is happening in the home. So it's not necessarily, even though if they're not involved and it's between the two parents, it's how that child is perceiving that argument and what the outcome of that argument may be.
Children are self-centered. The world literally revolves around them. Everything affects them. They see and perceive the world based on how does this impact me? And again, that doesn't mean they don't love us, but they're also always thinking about how does it impact me? Even if it is, well, the person I love will be gone. And I will suffer as a result. Right. And so it's depending on the ages and stages, again, the response is different. But as you said, it is about how they interpret it. So that's why multiple people can be and have the exact same experience. And not everybody will be traumatized.
Interesting. And so that is why we can't look back on how these kids are being raised and say, y'all soft. I tell my husband, I'm like, don't say, oops, he's one of the people. But he does think that there's a difference in raising our kids today, that they aren't as mentally tough. Now, mind you, he didn't have the best upbringing. So I'm like, well, if I have to be tough like you were tough, I don't want to be that tough. I don't want those things to shape me. So, and that's definitely very far from how he grew up. So I'm not sure how he would, how they could be tough in a way if the environment is completely different. So,
and there are different forms of tough. Again, there is a way in which you are tough by denying yourself your own feelings and pretending that nothing is happening, but then you rage or hurt yourself in other ways, whether it be, again, a lot of my patients who are adults, through substance use, through self-destructive behaviors and relationships, and lack of self-care that means a shortened lifespan overall. But there's also a way in which we can be tough, in that we can take our time to sit back and take care of ourselves and then get back up.
So and resilience.
That's the kind of toughness that we want to teach our kids. And what that requires is that we are their soft landing pad. We can't be the place that beats them up. We can't be that rough place, because then where are they going to go in for self-care? We are their care. We are caregivers. So they have to come to us for self-care, because outside, and if you witness them, they go outside and, we send them out there and they make it happen. And then they come home and they melt down. It's like, that was hard. And it's like, you're right, it was hard, but look how great you did. What else do you think you need next time to do better?
This podcast is going to heal me. I'm going to be a better mom.
That's the hope. That's my goal. Always better parents, happier kids, happier families.
So I want to talk a little bit about specific issues like depression in kids and anxiety, bipolarism. Are those things hereditary? Can people, so if mom and dad struggle with mental illness, is it more likely that kids will struggle with mental illness biologically? And then I want to talk about, how to identify these things in specifically teenagers and younger kids, preteens probably, because you hear about, younger and younger kids committing suicide, which is shocking to me, like 8-year-olds. So, is there a hereditary component in mental illness? And, and then we'll get into the rest of what I said.
The simple answer is yes, there is a hereditary component, because a lot of this has to do with brain chemistry. However, the other part is that sometimes, even when it's not a genetic situation, children learn by what they see. And so if we ourselves as adults did not receive the mental health support that we needed in order to learn effective and adaptive, appropriate coping skills, then that means our children are growing up in homes with somebody with untreated, unregulated depression or anxiety.
Mm-hmm.
And yes, being raised by a parent who is depressed is likely to lead to depression. If you can't have the kind of, your parent doesn't experience the kind of joy that a non-depressed parent does when you walk in the room or when you say something funny, that's going to leave you feeling some kind of way. That's going to deflate your sense of self and lower your self-esteem, which contributes to depression long term, right?
Mm-hmm.
And the same thing with anxiety. If you have a parent that can become easily dysregulated by triggers that they haven't identified or are not conscious of and don't know how to cope with, then that means that you're constantly walking on eggshells as a child, trying to predict your parent's mood. And that does create anxiety. Again, that fills you every time the parent erupts, then that triggers a fight or flight response, which floods the brain with adrenaline, and long term with cortisol, which leads to inflammation in the different parts of the body, and all of these will have negative consequences, right? Now, there are certain mental health disorders that definitely, yes, are inherited. Bipolar disorder is one of those, but many times, one of the things that we have learned is that we first rule out, again, I always rule out trauma first, because trauma can mimic a lot of different things, because trauma leads to an adaptive response to the environment. The child has to create a response that matches the environment in order to survive.
Interesting. So you have to rule out trauma because trauma can mimic mental illnesses. That's interesting. So
yeah, it can mimic ADHD, it can mimic anxiety, it can mimic depression, it can mimic bipolar disorder.
So, okay, that takes me to another question, but I want to talk about, like, how do you identify that your child may be struggling? So if we look at, like, preteens, kids, preteens, teens, like, I feel like they would present differently. So how do you know if your child is dealing with something like depression? Anxiety, I feel like sometimes it's easier to see. Or maybe to identify, maybe I'm wrong in that, but other suicide ideation, like, how do you know that your child is dealing with something like that? And what leads to suicide ideation? Is it automatically depression? Is it something else? Yeah.
Right. So I'll take your first question first. How do we know that something's off? The first thing is any sudden change in behavior. Any sudden change. I'm not talking about, well, these kids used to be like this 3 years ago and now they're like this. That's called they're growing and they're changing. But any sudden change within the last 2 months, your kids become really different person. Absolutely. It's time to pay attention. Either excessive withdrawal. And again, when I say excessive, compare them to themselves, not to your other kids, not to yourself, not to other people, to themselves. Excessive withdrawal, sudden difficulty sleeping or eating, any kind of significant change, either too much sleep or not enough sleep. If they seem always tired all of a sudden, and before they used to wake up easily, but now it takes, you have to go wake them up multiple times. Either overeating or undereating. If they're not, like, if they get up, they finish eating and they immediately run out of the room and go into the bathroom, that's a concern because they may be purging. And so these are the things that we're looking at. Any kind of sudden changes in behavior. If they suddenly change their social group, if everybody that they used to hang out with, they no longer talk to, and there's a whole bunch of new kids showing up, you want to pay attention to that. If they give up things that they used to love, and all of a sudden the things that they enjoyed, they no longer enjoy, and nothing seems to bring them any kind of happiness or joy. Those are the main things. And again, those actually can be both symptoms of anxiety and of depression, because excessive anxiety actually leads to shutting down. It's so exhausting. that kids end up shutting down. Anxiety sometimes actually can be harder to spot, even though we think about a child who's afraid, typically when we think about anxiety. But I've treated a lot of kids who were anxious, whose parents did not know they were anxious. It presented almost exclusively as physical symptoms, stomach aches, headaches, a lot of physical complaints. And the parents were like, we went to all the doctors, we took them everywhere. Nobody can tell us what's going on. The child was anxious. And because part of the anxiety is about disappointing people, they control their behavior, but it's going to get out somehow. And this is how it was coming out. Right. And as far as suicidality, the warning signs of suicidality are actually talking about it. A lot of people believe that anybody who wants to die by suicide will not talk about it, but they do. Most people begin by sharing that they're feeling like they might be better off, or that if other people would be better off if they weren't there. They consider themselves a burden. They talk about going away and ask questions like, what would you do if I wasn't here, or if I died? They start to give away their prized possessions and speak about the future with hopelessness, or stop planning for a future and begin to engage in self-destructive behaviors. One thing that I tell parents is that do pay attention to see if they're engaging in self-injurious behaviors, which can be cutting or burning, scratching themselves, and so on. But that does not necessarily equal suicidality. Sometimes children do that when they're just suffering a lot. And this is a way of them, a maladaptive way, but it's a way of them to cope with what they're feeling in the moment, because it distracts from the emotional and mental pain and focuses them on physical pain, right? And you ask what leads people to suicidality. It's not always depression, it's suffering. It's suffering.
Which is different than depression. Okay, suffering.
Yeah, and there are a lot of ways.
Yeah,
lots of different ways to suffer. Anxiety can cause suffering. Trauma can cause suffering, right? Bipolar, where you can't, nothing, you can't remain emotionally regulated and feeling like, what does my future look like if I can never achieve emotional self-regulation?
So what do I'm sorry. So what do parents do? At what point? So, you start to notice these changes in your kids. You start by talking to them, or do you immediately like, oh, let's go find a specialist? Like, how do parents handle situations like that? Where should we start when we first notice something versus this has been going on for a period of time?
The sooner that you bring them in, the better. It's easier to undo something and replace with healthy coping behaviors than if we wait until the maladaptive behaviors that they've developed on their own have solidified and they have become their habits, right? So then I have to replace a habit, which is more difficult than just teaching a coping skill. The first step is definitely to talk to your child and sit down when they're not distracted. My favorite time is when we're driving. That's an easy way. They're trapped in the vehicle with me. They don't have to make eye contact. I'm sure that you've heard that before if you talk to parents. But letting them know, I've noticed these things and I'm worried about you. I'm worried. So I label your own feeling. I'm worried because I love you, and it looks like you're not having fun anymore. It looks like you're sleeping a lot. Make sure that you lead with the feeling rather than you're sleeping a lot, where they might feel like that's a criticism. Right? I'm worried that you don't seem to be spending time with your friends, that I haven't seen you eating very much and I'm worried about it. Is there something going on, or is there anything that I can help with? If the child denies anything, you can say, I hope you can always come to me. Because I am worried, I am going to make a doctor's appointment so we can go see your pediatrician and talk to them about it. Sometimes kids don't feel comfortable talking to their own parents. And I told my own children, like, mommy is a therapist. but that does not mean that you will feel comfortable talking to me. Maybe you want to talk to somebody else. So we'll find you, you can trust your pediatrician. You've known her since you were little, and I can be out of the room if you want to talk to her by yourself.
Mm-hmm.
And let the pediatrician know ahead of time that you want them to be screened for anxiety, depression, and suicidality. And then they'll let you know if they feel like there's a need for additional interventions. Sometimes the pediatrician says, this seems normal for their age. If you continue to be concerned, there is absolutely no harm in calling your insurance company, asking for a referral for a therapist, and talking to a therapist. The worst that I've ever said to a parent is, this kid seems pretty normal to me. This is just
Mm-hmm.
a stage. Do you want some support to, for yourself, to make sure that, they're doing okay? And I provide them with resources and connect them in the community with
Mm-hmm.
parent groups and so on, and or direct them to the schools. The school is another good place to talk to either the guidance counselor or the school social worker, is somebody that can meet with your child, and also pay attention to talk to the teachers and see if they notice a difference as well.
So when you're if you have a kid who is dealing with any of the things that we just discussed, can they be healed from that? Healed is the word I'm using, but I don't know what the proper terminology is. But if they are depressed, if they deal with depression or anxiety or suicide, ideation, do they have to be on the lookout for that for the rest of their lives? Or is it something that they can say, I used to be like that, but I'm not like that anymore? Or is it always something that they are carrying?
Right. So I think that in a way, again, it depends on the source of the depression or the anxiety. If we are dealing with something that's biological, then yes, they're always going to have to pay attention to that, and they may need medication, which actually I want to kind of take a sidestep to something that you said earlier. You said many times the pediatricians don't know what to do. Well, the pediatricians know what the kid might need, but the pediatrician only has one tool, which is medication. They
Right.
can't do therapy. Right.
Mm-hmm.
So even if the pediatrician can tell you, yeah, this kid is depressed or this kid is anxious, the only thing that they can offer you is medication. And I'm not against medication. Many of the kids I worked with are on medication, but medication does not heal life.
Mm-hmm.
Right. So yes, it's really important that, yes, there are children who are going to need medication in order to treat their symptoms. However, medication does not heal life. And regardless of which medication you're taking or what diagnosis you have, you're going to need to learn tools to manage your symptoms and to cope effectively
Mm-hmm.
with the symptoms that you're dealing with. And so there are times when I do encourage medication early on, and then to taper off, because if the symptoms are too intense, then there's very little work I can do, because the person is it's avoiding the symptoms. So if I can, if we can reduce the symptoms of the severity of the symptoms early on, then I can teach tools by exposing the person to the triggers. And as they learn the tools and master those tools, I can talk to the doctor and say, hey, can you taper them off the medication, and let's see how they do without it. There are certain disorders that doesn't really work, when we have to stay on medication long term, because it's kind of like diabetes. Sometimes it's just, you just have it, and you just have to deal with it.
Yeah.
And but
So,
still, it's important to have tools.
okay. So what I generally find is that people who don't have kids on medication are hesitant to put their kids on medication. And maybe that's your experience too in practice, that you'll find a lot of parents are hesitant to put their kids on medication for whatever reason. I mean, you're ingesting, medicine to heal, what is a mental disorder. You are, you know, labeling them as something, and maybe this will follow them around forever, that you took medication, whatever their concerns are. So how do you alleviate parents' concerns about putting kids on medication or
I think
teens?
that yeah, the medication, the hesitation to start children on medication is warranted. I don't think that we should jump to medication right away. I
Hmm.
think we should try strategies and see what can work and make sure that we have the right treatment plan for a child before we say the only thing that can help at this point is medication. Because for a number of reasons, like you said, there are chemicals, there are always going to be side effects for everything. There are side effects for everything. But that includes any chemical we put in our body, including many of the foods that we consume, right?
All our
And
foods are
so,
chemicals now.
right, right. But I mean, there are chemicals in the food that we consume. We drink milk. Some people get stomach aches after drinking milk,
Yeah.
right? And so there are side effects. We still weigh the pros and cons of all of these things, right? And
Hmm.
so one of the things that I take into consideration that I talk to parents is I want to know what your hesitation is. Is it coming from I just don't want my kid on any medication? Or is it coming from I've had negative experiences with doctors and with medications in the past? Is it, I believe that these things are addictive because I know so and so, and they were always having to add more medications and more medications. And so answering those questions as best as I can, depending on what their concerns are. I know that a lot of people, some medications for children come with very, very strong warnings, and some of them are controlled substances. And parents are like, I don't want to put my kid on that. Well, I mean, I wouldn't take a heart medication. That would be bad for me because I don't have a heart condition. Right. And
Hmm.
so, yes, there should be a warning about taking a heart medication for somebody who doesn't have a heart condition. Your child, if they have a condition, would not be negatively affected by taking the medication, but other people should know that they shouldn't. And so again, I work with parents and children, and regardless of whether or not they want to try medication or not try medication, but I always say the following: if you're asking your child to process and to function without medication, when medication is one of the things that they need, that's fine, as long as you are okay with, number one, not rushing them to make progress, and number two, not having and setting very high expectations for them, because
Hmm.
they're coming from, they're trying to get to a point that may seem fair to you, but they're coming from a much farther distance,
Hmm.
and so they may not make it. and
Mm.
And so I just make sure that they understand, if you're going to be patient with me, I will deliver the best that I can as far as outcomes. But don't expect the same outcomes as you would with all of the tools and all of the um, resources that we have available in place.
Hmm. This has been really good. And I'm like, I could literally go on and on and on, but I will not. I I will ask you a few more questions, a couple of more questions. I know
Sure.
people are like, you just said you were ending. A couple of more questions, specifically about how do you take care of yourself when you're dealing with children who are dealing with these hard things? How do you not let that seep in and take it home with you every night?
It takes being proactive. And part of that proactivity is about self care and mental wellness. When we think about wellness and well-being, you think about the fact that you take your children to a pediatrician once
Mhm.
a year, even if they're perfectly healthy, for a wellness check, and
Mhm.
you take yourself to a PCP and get all your checkups done, once a year or every other year as well, even if you're feeling perfectly healthy. And I don't think we do that enough with our mental health. And so I have my check-ins. I definitely have my people that I go, if it means every couple of years I go in and see a therapist for a few months, just to be like, hey, I just want to make sure that I'm okay and that I'm doing everything I'm supposed to be doing, and that this is just normal stress that I'm dealing with, right?
Mhm.
So that's one thing. I also make sure that I take care of my body, because if I cannot take care of my body, if I don't practice what I preach to my clients about getting enough rest and eating healthy diets and exercising, then I won't be able to function. And I'm honestly would feel terrible as a hypocrite if I'm not doing the things
Mhm.
that I'm telling my clients to do. But also developing a strong social network and depending and counting on my colleagues who are people that I admire so that I can turn to them when I feel like, hey, this was a terrible thing I just heard. And without violating client confidentiality, right? Making sure that I say, am I doing everything I'm supposed to be doing here? Ultimately, as long as I feel that I'm doing everything I'm supposed to be doing, and that I have the support that I need to do the work that I need to do, and that everybody that needs to be on board is on board, then I actually end up feeling really good. And it's not something that I end up taking home, because the greatest privilege of this work is that I have people come to me during after their most difficult moments, and they trust me with this information that they often don't trust other people with. And once they lay that on my lap, it's an honor for me to help them carry that burden until we can dump it. And we will walk together until we can get rid of it. And especially these little ones who come in there and tell me everything and what they want. I'm like, yes, let's do this together. Thank you for trusting me. It's something that is incredibly rewarding. And that's how I do it, because I ultimately end up deriving a lot of joy from it. Not from the sad story. The sad stories are heartbreaking, but from the knowledge that we're going to end up in a better place, and that I'd rather remember you for the person that you will become than for the person that just told me this very terrible thing that happened.
Oh, I'm going to cry. That is so amazing. The world needs more people like you. I think if everybody could this should be a part of parenting. I feel like God should just give us resources. And it's unfortunate that everybody doesn't have an opportunity to have that. It's a shame that I didn't get to have that. But, we're all, I'm just grateful for the opportunity to have this conversation with you, but also to grow in my own life and learn. And I hope people get a lot from this conversation, because to me, it was so helpful and so good. And it actually made me feel a little bit better about what may come, or dealing with something. So I hope somebody else got something out of it. I do want to talk about a program that you have that's called Decolonizing Parenting. Now, that's a name. I want to know what that's about. Decolonizing Parenting. What is that about? Tell me.
So that is it was a great idea that my sister came up with. As you know, my sister is full of fantastic ideas. Jari Santana-Wynn. It's the great mind that comes up with all of these wonderful ideas. But it was actually part of the conversations that we've been having as she raises her children. And when she comes to me with like, hey, how do I do this? And hey, I've read this in parenting magazines or books, but it doesn't quite vibe with our culture and the way that we were raised, or certainly some of the beliefs that we now know that come from our colonial history as Afro-Latinas. And so exploring what Afro-Indigenous cultures and parenting cultures were, and then trying to match that to what we feel that our children need, and talking about it through the lens of a clinical lens of child development it was just a set of conversations that we had, and we recorded them, and hopefully they will be of value to others. I talk about some specific topics and concerns, behavioral concerns and mental health concerns, but also just about everyday parenting for the different stages, our littlest ones and those middle schoolers and pre-adolescents, and then our teenagers who are a completely different ballgame, right? And so we had great conversations, and we recorded them, and they're available online to be purchased, and they can be found on my website, drjari.com. And nice. Your listeners can use a discount, so you can go ahead and send that discount code to them, and they can get a 50% discount.
Excellent. I will be putting that in the show notes along with the discount code, which is amazing. Thank you very much. It is an interesting conversation, because I think, slavery, colonization, white supremacy, it dominates our conversation today. I mean, I think it's so funny when people are like, stop talking about it. But it's like, it permeates everything that we do, including our parenting.
Right. And what we did was basically we actually stopped talking about it. We removed it. We're like, we're not going to talk about anything that came from that. We're going to talk about what parenting was like before.
Mm-hmm. And you're going to talk
about colonized.
Really? So so we're going to talk about how our ancestors parented before. And I love that, because here's the thing. People think our history in particular in America started with slavery. Yeah. And it's so hard to identify and for us to connect to what our life was like before slavery, what our ancestors' lives was like before slavery. So that's interesting. So it's not, how did these things affect us? It's no, how did our ancestors parent before going through, now that was trauma, through that trauma.
Yeah, it is. Absolutely. Absolutely. It was trauma. And that's trauma that got passed down to us and our parents. And again, our parents passed that on to us, and it's not by fault of their own. It's what they learned and what was taught to them. And so when they talk about you're soft, yeah, back then you couldn't have those feelings. And now we're saying, but you know what? Before that, we were allowed our feelings. We were incredibly expressive people. Let's return to that.
Is that what when you said passing on from parent to, is that generational trauma being passed on? Is that what that is? Okay. That's a whole other subject.
We can do a whole podcast just on that.
Just on generational trauma. Okay. I'm so interested in the decolonization, decolonizing parenting discussion. So I'm definitely going to download it. So
I hope you enjoy it.
I'm sure I will. Thank you so much, Dr. Jari, for coming on to the podcast. You were so informative. I know this is going to help many people. So thank you so much.
Thank you, Sonia, for having me on your show.
No problem. And for everybody else, I will see you next time.